welcome to this week's webisode on Flan.com, your source for all physiology and pathology fun facts.
Today we're going to be discussing asthma, and we're very lucky because starting off our program we get to hear the first experiences of real asthma patients, Evan and Anthony. Please give them a round of applause.
Hey guys, I'm Anthony. When I was a little boy, 3rd grade, 2nd month of school in October, I had RSV. So in the middle class, I just started, wheezing, coughing. It was really tough, and my teacher got really frustrated at me. She was real angry, and so I left the classroom. But when I left, I kept I couldn't do it. I couldn't breathe. It was really hard, and it was bad. It was a really struggling time for me. But thank the Lord now. I have my inhaler. So when these things happen, the teacher doesn't get mad. I just have my inhaler there right in my pocket, pull it out, and I'm okay. So yeah, just bring your inhaler with you is really key for me personally.
Hi, I'm Evan. I really like cats. So this fall, I actually bought one, and I brought it home, and I discovered that I was having a lot of labored breathing. I was wheezing and coughing. It was very uncomfortable. So I went to the doctor, and he said that my allergies were probably related to my cat, and he said that I have allergy-induced asthma. And then the spring came around, and I actually had it again. It was caused from hay fever, which is from pollen and all the other things in the air that you breathe in. And that also caused some allergic reactions, and that caused the asthma.
Okay, let's take it back to the board and look at the physiology behind what's going on with Anthony and Evan. So both of them complained of coughing, wheezing, and labored breathing. So if we look at the physiology behind this, we can see that the bronchoconstriction would reduce the volume in the lungs, which would reduce the amount of air one could breathe in one breath, which causes the labored breathing, coughing, and wheezing. And then further, we see that inflammation, which could be caused by hay fever and allergies in Evan's case, and that's caused by irritants in the lungs, which cause a release of histamine, which further reduces the volume of air able to get into the lungs. And finally, we have mucus secretion, which is also a result of that inflammation, which further reduces the volume of air that you can get into the lungs. So that's why asthmatics frequently complain of symptoms of labored breathing, wheezing, and coughing.
Thanks, Jess. Now we can look at a few other ways to measure if someone has asthma or other chronic diseases of the respiratory tract, because we know that they have those 3 symptoms that are exhibited physically that Evan and Anthony talked about earlier. The other way we can diagnose asthma is by having a patient breathe into a spirometer or other breathing device that can look at the lung capacity or the volume in the patient, as well as how fast air is moving out. So if patients are asked to breathe into a spirometer, we would look at a graph similar to this to look at that end of maximum expiration to see how fast patients can breathe out. And if that is decreased or if the volume is decreased, this would be another diagnosis toward asthma. And now we can review again the pathology of asthma. So here we have increased mucus secretion as well as spastic contractions of those bronchial walls. And it's important that we want to relax that smooth muscle as well as get rid of the mucus secretion if we're going to suppress an asthma attack or prevent one from happening in the first place. So here's a common diagram of all of our adrenergic receptors we need to know. And for asthma attacks and for looking at different ways to prevent them and to treat them, we're going to focus in on beta-2 adrenergic receptors, which we know are normally inhibitory towards that binding with norepinephrine. And beta-2 receptors can be found in the respiratory tract. So the good news for asthma is if we were to administer short-acting beta-2 agonists, we're going to increase that inhibitory beta-2 response. And so physicians will prescribe that through inhalers and also through long-acting beta-2 agonists in order to bring back those asthma attacks while they're happening. And that's what we heard Anthony talk about, was bringing his inhaler everywhere. So here in the top left, you can see that inhaler there, and it's also combined with a spacer, which will allow for better diffusion. Another option for treatment of asthma is a preventative measure called a nebulizer, and this is going to administer medications such as cromolyn, and that will allow us to prevent any of those spastic contractions as well as anti-inflammatory of the lungs. And then finally, we also have corticosteroids, and that's going to help with anti-inflammatory. Thank you for joining us today. I hope you've learned something new about asthma.